Hey everyone, welcome to the Balanced Lens, where we talk about faith, culture, and politics from a balanced perspective. Today, we're talking about a period of American history that many of you have went through, the COVID-19 lockdowns. 5 years later, we're still talking about Anthony Fauci and how he handled this whole situation. And this has made a lot of national headlines recently. And so we want to dig deep into this and ask ourselves, what can we learn from how Fauci handled the situation and how, as a nation, we responded? So to begin with, just a few weeks ago, Fauci appeared before Congress, invoking the Fifth Amendment more than 100 times in the recent Senate hearing. What does this signal about accountability for pandemic decisions?
So everybody watches hopefully on TV. It was entertaining to watch, to say the least. So Senator Rand Paul, who's actually pursued Dr. Anthony Fauci for like 5 years over COVID origins, subpoenaed him. And days before the hearing, Rand Paul's office released over 1,000 pages of Fauci's personal pandemic-era diary, which is obtained from what Teacher's Secretary Robert Kennedy Jr. said was an 8-month effort to pull the records of 11 agencies' servers. So Fauci opens up by calling Paul's pursuit an unhinged obsession, and then he invokes the fifth to every question that follows, including the ones about his health and family, right? So he says something along the lines of, the sole reason he, meaning Rand Paul, is calling me before this committee is to get me to say something, anything that could vindicate his repeated public pledges that I end up behind bars. So this was his opening statement. Now here's a wrinkle, right? President Biden pardoned Fauci in January 2025, but that was only for federal offenses, and it's tied to his official roles between 2014 and January 19th, 2025, the day of the pardon. It does not cover anything that is said in this hearing or any hearing past January 2025. It does not cover any state prosecution. And, legal scholars still have an unresolved question, which is rooted in the case of Barron versus Walker, or whether a pardon like this fully extinguishes the right to invoke the fifth. The Congressional Research Service says there's no controlling precedent on this point. So they aren't sure. It's a gray area. So what does it signal? This is your question, right? Two things, and both can be true at once, right? That functionally 100 plus Fifth Amendment invocations, it produces zero new sworn testimony. And even like a person her name is Celine, who was a Biden transition COVID advisor, told The Hill that she saw no bombshells, just a document dumped which was timed to generate headlines. Scrutiny got deferred, nothing got resolved. But constitutionally, remember that, and we talked about this when we talked about our Constitution and all the amendments, the pleading the fifth is not an admission of guilt. Even though several senators treated it like that when they were talking in real time, if a partisan chairman like Rand Paul has spent years publicly demanding your imprisonment, that's arguably exactly the scenario the privilege exists for. So that's my read, that the refusal was a legitimate constitutional practice and simultaneously an accountability didn't. So it was unfortunate. We got nothing new, but his actions of pleading the fifth make sense given the circumstance.
Yeah, and that's going to be controversial, right? Because it's a hypercritical environment, not just from Republicans, but also Democrats that want him thrown in jail. And there's a lot of misery. There's a lot of sorrow around COVID-19. Many people lost family members. Kids lost years of their lives. Mental health episodes exploded. And people are looking for a scapegoat. And like you mentioned, Rand Paul has said publicly he wants to throw him behind bars. And so if I put my shoes in Fauci's perspective, I probably would have sworn the fifth also. I know you're not going to agree with that, but this is balanced, right? Now, as a conservative, I want accountability, right? I want transparency. I want scrutiny. There's an expectation I have of my officials. However, I do understand why you plead the fifth if what you might say could potentially land you behind bars. And so I see both sides, right? And I think if you look at this carefully, and we're going to talk about this a bit more, why he pled the fifth. Did he have answers? I'm sure he did. But again, the consequence for him was much greater than the consequence for you and I listening behind a TV. Now, one of the sour spots or sore spots for a lot of people is they allege that he downplayed the origin of COVID-19, given newly released diary entries and emails. How much did Fauci privately acknowledge or downplay the possibility of a lab leak or U.S. funded research links to Wuhan early on versus what he told the public and versus what he told Congress?
This is a point of great heartache. I would say people are struggling with this, and it's hard to sometimes like figure out what the truth is with all the public statements that everybody tosses back and forth. So on January 26th, we are going all the way back to 2020, which by the way is 6.5 years ago. Crazy to think it's been 6.5 years. So Fauci writes in his diary that data suggested that the outbreak predated and wasn't tied to the Wuhan market. So what he wrote is the market was not the source, it was the amplifier. Now, days later, he documented a call where 9 out of 11 scientists thought that deliberate genetic insertion was possible, with 2 of them saying it was natural, right? But they also said that accidental lab release was more likely than an intentional release. So Senator Rand Paul's office calls this as proof of cover-up, since Fauci spoke far more confidently in public by April and May, telling the National Geographic the evidence was very, very strongly pointed away from engineered virus. But when PolitiFact went line by line, they found that the core privately knew one thing claim was largely like unsupported, because his February private and public statements kind of track close. His growing public confidence by springtime, which is when the April-May timeframe, mirrored the broader scientific consensus at that time, which was shifting in real time. So it was not like a hidden reversal. Like on school closures, for example, his diary actually shows him consistently pushing to reopen by around mid-2020. So that matches his sworn testimony in July 2020. And so it's tough, but there is a viral claim I've heard that the diary called mass ineffective, and that's also kind of false, because its actual diary says that officials probably were too strong in saying that mass do not work. He didn't use like that type of explicit, definitive language when he was writing about it in his diary. So the bottom line I would say is that the diary shows real, honest, scientific kind of uncertainty happening in early 2020, January, February. Doesn't look like anything documented as a deception. Now, there is a dispute over gain of function funding, which I know we're going to cover later. But if you look at like the technicalities, right, both the FBI as of January 2025 and the CIA both lean towards a lab-associated origin, even though the CIA has it a low confidence. Their conclusion is at a low confidence, and there is other agencies that have said it's leaning towards natural. So there is an honest disagreement on the origins, which is fine as long as it's public and it's transparent and it's based on whatever people know to the best of their knowledge. It's totally fine. It's good to have open debate. The question was, in this particular question, what you asked was he hiding something behind? And it doesn't seem like it so far based on what I've read and seen.
Yeah, and publicly under oath in 2021, Fauci stated that the National Institute of Health and the NIAID had not funded gain-of-function research at the Wuhan lab. Now, where this is tricky, right? The definition of what this means, right, is contested, right? What exactly is gain-of-function research? Critics contend that these experiments met the criteria under pre-pandemic conditions. Defenders argue that the specific viruses were genetically distant from SARS-CoV-2, right, and should not have been its precursor. But like you mentioned, the intelligence communities were divided on the origin of this. And so to state that this was like an intentional cover-up, right, that's not fair, right? I think if you're honest with yourself and honest with the data, right, this wasn't intentional. Now, some say that there were efforts by Fauci and his colleagues to counter the lab leak hypothesis in public messaging and try to steer away from that narrative. Fine, but I don't think this was a categorical lie that, he was trying to make here. And so I think you need to really dig deep into what third-party agencies like intelligence communities and academic institutions have said about the origin, which many people now say is probably zoonosis, transfer from an animal to a human, maybe amplified by other factors. But again, still divided on this. And so to hold one person accountable and say he lied, I don't think that's fair. And that really is misrepresenting the data here. Now, he did advocate lockdowns. He did advocate school closures, other non-pharmaceutical interventions, and his reported efforts to counter this Great Barrington Declaration, which basically says that we should protect the vulnerable while allowing lower risk populations to go and do what they please and resume normal life. People say he countered that, and they say that this was a reflection of the best available science at the time. But was this an overreach that caused lasting harm? Because the response in the US was very different from other countries. And actually, there were worldwide, you look worldwide, there were many different responses in how countries issued their public policy towards this pandemic.
Yeah, so there's been a lot of discussion around this as well, right? The lockdown, the type of impact it had, right? And what we learned from hindsight. Now, hindsight always is very more revealing than, when you're in the moment. Just to do a quick flashback, remember we were talking about a time when there was a lot of uncertainty. This was a genuinely different strain than that we have seen. It was proving lethal at first strike. It was actually proving that there was some lethality in the virus. I remember very clearly how infections were rising and people were rushing to hospitals, and it was widely reported that hospitals could not manage beyond a certain number. We had constraints. If you remember, at that time, President Trump ordered emergency manufacturing and transformation of hospitals to accommodate for for patients who come infected with the virus. So we were at a time of a lot of unknowns and serious worry that hospitals would not be ready if a spike happens, and that's going to cause mass casualties. So this was the background. So given that even Dr. Fauci or anybody else in the scientific community, they also had limited information at this time. They were all investigating and trying to adapt real time. That's a background of what we are talking about. So with that background, let's make sure that try to step into the shoes of people who are trying to do the best they can with the information they have, and making sure that the public is aware and they are able to, nationally, we are able to kind of manage the virus, right? So there were three epidemiologists, and this is where the Great Barrington Declaration comes from. There were three epidemiologists from Harvard, Oxford, and Stanford, and they basically published the Great Barrington Declaration in October 2020, and they argued for focus protection, right, versus blanket lockdowns that we were having. And there was this incident where one of the NIH director, his name is Francis Collins, emailed Fauci 4 days later calling, this is what he said: there needs to be a quick and devastating published takedown of its premises, right? He was so against it. So records actually show that Fauci's staff compiled op-eds attacking the declaration, and Fauci later admitted that he'd come out very strongly publicly against it at the same week. So separately released material, including Missouri versus Biden case records, show that Google search results for that declaration shifted within days. Facebook briefly pulled its page. 3 tenured scientists were branded French by the two most powerful biomedical officials in government at the time. And so this is not like what you would expect from a scientific rebuttal perspective, right? It's like a suppression campaign. And by the way, this is all documented things. None of this stuff is controversial. So that doesn't mean that the Great Barrington was scientifically correct. That's not what we are saying. That's clear. But if he had gone down that route, would that be effective? Because it's easy to say, okay, let's let the small kids do whatever they want to do. Well, what about the grandparents who are living in my house? So the small kids go in, they come back from school. What about my parents who are living in the same house? So there are nuances that we have to be careful about, even in that theory. So there are some things to think through. There's a widely cited John Hopkins economics paper that found that lockdowns cut mortality by just under 1%. But that's not been necessarily peer-reviewed, and it excluded also most epidemiology studies. So I would say most independent critics are not fully aligned with that. But the mortality trade-offs remain like genuinely contested. Like what is well established across multiple peer-reviewed studies, meta-analysis, is that the cost of school closures specifically was pretty high. There was learning loss, especially among lower income kids. They found that a year of closure for about a year or so had direct impact on the children's mental state. This is a time when children play, they interact, they grow. And there were tangible impacts whose effects are probably going to last a generation or more. We do not know what the consequence of what we did is, because those kids that were, just imagine the kids who were like anywhere between 3 years old to 10 years old, right, is now about 10 to 17 years old, right? They are in middle and high school. They're going to go to college. How are these guys going to take the next step into adulthood? We don't know. We haven't seen it happen. So there is real costs that happen as a result of this. And so this is a legitimate thing to wrestle with. What happened? Why did it happen? And most importantly, how can we make sure that this type of scientific suppression of dissenting voices?
Yeah, very well put. And as you began with, this was a time of panic, right? We weren't sure if you would go outside, breathe germs, and die. I mean, I had friends who worked as nurses who said goodbye to their kids, sent them off to other family members, assuming that they would not see them again, literally packing them with a suitcase with their clothes and belongings because they worked in healthcare facilities and genuinely worried that they would die. Like you mentioned, this was a time where we had that tracker, right? Do you remember the tracker that just kept going up every day, and you watch the news and it's like the most depressing thing to see, the number of deaths like every day, and you're wondering, like, gosh, like who's next? It was just a highly dynamic, volatile situation. And looking hindsight, we're all going to have our answers, but we do not want to discredit the gravity of the moment and what happened during that time as we discuss his response. Another thing to note is this. The lockdowns, like you mentioned, the school closures, the delayed appointments for health visits, the postponed surgeries created a category called excess mortality. The excess mortality deaths during COVID-19 were much higher than the actual number of deaths themselves. People estimate between 7 million worldwide COVID deaths, but 2 to 4 times that number of excess mortality deaths, anywhere from 15 to 25 million. In the US, about 1 million people died of COVID. Now, again, this number is nebulous because, if you had a pre-existing condition with asthma, like what killed you? Was it the COVID or was it the asthma, right? So again, the thing to remember here is that the excess mortality deaths created a much higher bucket of fatalities. Now, I start by saying that because people look at countries like Sweden and they use that to crucify Fauci. Well, they're like, country like Sweden, they had a much different response. They never imposed a nationwide stay-at-home order. They didn't close most businesses, restaurants, gyms, or elementary schools for periods of time. The general strategy was voluntary social distancing, work from home recommendations when possible, like limits on gatherings, targeted protections of the elderly. Now, what's interesting, if you look at the Swedish data over the full 2020-2022 period, multiple analyses showed that Sweden had the lowest mortality rate in Europe, or one of the lowest mortality rates in Europe, with excess mortality deaths around 4 or 5% of baseline, much lower than the European average and substantially lower than the United States. So you look at that and you say, well, Fauci should have done what Sweden did. Well, 2 different countries, right? I'm going to say this. The level of public compliance in the Nordic countries is much higher than it is in America. In America, you tell someone to go right, they'll go left, right? Like if you live in America, you understand what that means. People in America do not like their freedom taken away. And so hindsight, right? Looking at his response, he had to decide whether I'm going to be a clear-cut public figure that's going to give a very decisive, certain action and model my response based on that, or am I going to give nebulous statements where I say, well, some data shows that social distancing is bad, and some data shows that going to school is bad, which what we call is transparency. But from a public policy perspective, that's also called confusion, right? And so to swing a bat at him and say, well, he intentionally lied to the public and he knew lockdowns were bad and masks were bad and so on, not fair, right? I don't think you're taking into account the differences in the population of the United States and the population of other European countries, which are much more homogenous in their cultural identity and values. And so, again, could he have been more transparent with information? Probably, but remember, we're all glued to him watching that tracker. Uncertainty and nebulous answers in the middle of a crisis are never good either. So I think at the moment he made a decision to issue guidance that would, in his view, attempt to minimize death. And whether looking hindsight you like that or not, I think he was doing what he thought was best to do. And so conservatives will argue that, as the uncertainty lessened and the pandemic went on, that he continued these maximalist non-pharmaceutical interventions and actively discouraged alternate strategies, reflecting a preference of control. Possibly, but again, the fact that we were a year into the crisis doesn't mean that less people were dying. We still had overcapacity in hospitals. We didn't have a virus that was, a vaccine that was actively distributed for a while. And so, I think during this time, as he was trying to dictate public policy, ultimately he was trying to save lives, which inadvertently, right, looking hindsight, the excess mortality that resulted from, again, the mental health issues, the delayed doctor's appointments, the bad eating from sitting at home all day, right, the lack of just walking around, all those categories of excess mortality were 3 or 4 times worse than the actual fatalities of COVID. But looking back, right, with the benefit of hindsight and declassified materials, should Fauci face further legal or professional consequences for these possible inconsistencies on origins, research funding, and public messaging? Or should we focus on broader systemic failures that we should try to prevent?
You hit the nail on the head, right? So this is what we need to figure out, right? So the thing I do like about Senator Rand Paul is he's trying to hold people accountable. And to be fair, he's done that to President Trump when I remember when they did strike drug boats off the coast, right? In international waters. Rand Paul was very, very critical. He's like, how, you don't know that for certain. You cannot take away somebody's liberty. They have to come and let them answer the questions and let them actually face the question and answer. So what he's trying to make sure is that there is accountability, that people are accountable to their actions, there's proper oversight. So that part I do appreciate. The question becomes, are we in danger of being lost in the forest? And because what are we trying to solve, right? One thing that we want to solve is if there was genuinely something that was done that is wrong, you want to hold people accountable, fine. But more importantly, you want to make sure that we are ready when something like this happens again. What do we change in order to make it right the next time? That should be always where our head is, right? Because what happens when things are not transparent and people are skeptic about the public health statements that are happening, right? The more skeptic the population is, how are you going to control the next pandemic that comes along? They're going to be like, well, you lied to me in 2020. Why would I think you're doing anything different this time? Right. That is the genuine question in front of us, right? Now, should we go after Fauci? If he's done something wrong, sure. Right? But right now there is nothing that's out there that shows it. Plus one good thing that comes out of situations like this is scientists that I believe there was somebody who pleaded guilty who was part of the team a couple of days ago for using private emails and stuff to cover up. So one of the good things that comes out of things like this is you're going to put people more in the account, people are going to be more careful in what they do, in what they say, right? They're not going to try something like this again next time. So that is one positive thing that can come out of it, right? But the more important thing for us is how do we make sure that Congress does have, maybe they should reform the way they do the gain of function oversight. If there's a technical definition and people are not sure, well, let's clarify that. Let's get the definitions right so people are not arguing about that, right? Let's make sure that people who dissent, and this I think is definitely a big one. If just because there are dissenting scientists, let's be careful not to call them fringe and you must be some conservative or liberal wacko. that kind of labeling is very problematic. We need scientists to go off the evidence, not off politics or what they believe. Let the facts guide you, let the evidence guide you to your conclusion. And it's okay to end up in different conclusions. That's fine. But let's not immediately flag the opposition as fringe or call like derogatory terms. That is by definition unscientific. So it's kind of ironic how unscientific some of the behaviors of our scientists are today. We need to get out of that and get back to fundamentals and make sure that we follow the evidence. And then from a transparency perspective, I agree with the point that you said. How do you balance it out to population? What, you're going to tell them everything? Like, we're not sure, guys. Maybe you should do it or maybe you shouldn't do it. It's a good point. That is a good point. But so then let's have a resolution to that. Like, for example, could Dr. Fauci and his senior team have briefed a select committee within Congress in both House and Senate so that at least we have a broader group of people who are elected officials who have information, right? Right now we have to only trust one person or two people. That's not going to be okay long term. So maybe something like that. So let's think about how to make sure that this doesn't happen again and systematically resolve the issue versus, going after the 85-year-old Fauci at this point of time.
Yeah, and people who want to go after Fauci say, well, there are definitional disputes of this gain-of-function research. They say there was an effort to shape the narrative of the origin of COVID-19. They say that he suppressed alternative policy proposals. They look at his diary and they say there was evidence of awareness of, different theories that, he could have propped up more. Actions of his close associates, right? His one senior advisor, forgot his name, but he just pleaded guilty to concealing federal records. People look at that and say, well, for these reasons, let's crucify Fauci. But again, if I'm going to be balanced here, right, there are reasons why some of these statements were made, right? As a public official, right, unclarity or being vague does not help when you're being propped up as the sole authority on this dangerous virus killing tens of thousands of people every day. But I would like to say, what can we do systemically, right, as a nation, as a society, to ask ourselves, are we really prepared the next time? So rather than crucifying Fauci, I'd like to say, what have we learned from COVID-19? If this happened again next week, just like it did last time, we had no idea. I remember it was 72 hours, and it was a Saturday when we heard about COVID-19, and I think by next Wednesday, things were just locked down. And this can happen in a week, but as a nation, are we prepared? And so, looking at this at a high level, right, there's a couple issues that, I want to bring up here. One, you look at the testing failure. The CDC's own diagnostic test was faulty in February 2020, and the FDA's emergency rules simultaneously blocked academic and commercial labs from deploying their own working tests. Right? This is literally a month after this virus has become mainstream. There was no real-time national database. Cases and hospital data move via spreadsheet and fact. The recent Government Accountability Office report still lists establishing an electronic public health situational awareness network as a priority and as a recommendation. 6 years later, it hasn't happened, right? Emergency spending during that time had no fraud control. Nobody was clearly in charge. There was a mix of federal versus state division of authority that was never resolved. That still exists today. The credibility, right, obviously has shot, right, from the CDC and Fauci, now any government official. Interesting research here. A June 2026 Harvard Beaumont poll found trust in CDC recommendations fell from 77 to 50% in a single year. Now, the breakdown is interesting. Among Democrats, trust fell from 92% to 34%. Amongst Republicans, it kind of held steady, right? But what's interesting, right, was that the credibility of any government official, especially someone from the CDC or the NIH, is shot in the next pandemic. Who are we going to trust and who are we going to listen to? Finally, the U.S. never had a proper postmortem. You think about 9/11, right? It's 25 years later. In a few weeks, there was a 9/11 commission that was privately funded because the government wouldn't do it, that thoroughly investigated the root causes of what caused this massive catastrophe and failure in security in the United States. There's never been an independent COVID-19 crisis group that's actually went back and studied the crises, proposed recommendations, and given us a path forward. So as much as we want accountability and transparency, we all do. I don't think crucifying Fauci right now is the proper path forward in this type of situation. And so there's a lot that we can learn. There's a lot that hasn't been addressed. Even if you look at other countries and say, well, country X did this and country Y did this, there are big differences. For example, in Taiwan and South Korea, they had much better prevention rates and isolation rates. Well, they also had experience with SARS and MERS. And so the population was very well versed in what to do. And so the rapid border closures, the rapid contact tracing and testing, these were secondhand nature in, many of these Asian countries. Even if you look and say, well, I still think Fauci is horrible because other countries handled this better, you need to look at the rates of public compliance and trust. I alluded to this before, but in the United States, in general, public compliance among people is low. People do what they want to do, right? They cross red lights. They throw trash on the street. The willingness to abide and guide and follow guidance on masking and distancing and quarantining, those are going to be low. And is that the right course of action, or is this the right foundation we want before the next pandemic or next virus hits the country? And so, again, there's so many things that we need to consider, whether it's compliance or a commission or even healthcare capacity in our hospitals, right? Have we addressed the shortages that we had and how we can quickly, increase any type of capacity in the event of a sudden onset of a pandemic? And so, moving forward, I'd like to see more of that. What's going to keep me and my family alive in the next pandemic, as opposed to finding a scapegoat who is questionably a scapegoat right now and, pouring out all of our wrath on him. Finally, as a Christian, right, what can we learn? Like, looking back, 6 years feels like last month. Like, you think about, wiping down your groceries and washing your hands 10 times and wearing your masks, and it feels like it was yesterday. But hindsight, as a Christian, what else can we learn from this?
I was thinking about that, right? Like, so you think about, I think as a Christian, right, we have to be very careful when we make judgments. It's very clear in the Bible that Jesus talks about the way you judge others, in that same manner you will be judged, right? To those who have shown mercy, mercy will be shown. So what I gather from all the different things that we learn in the Bible, it's trying to teach us how to not jump to conclusions, to examine the evidence, right? You don't have to you don't have to lie for someone. You don't have to hide it. That's not what the Bible is talking about. It's not saying to not judge in the manner that if you see someone killing somebody, you call it as it is, right? It is saying that don't jump to a conclusion about Fauci or what he did or what he wrote or whether he was deceptive before you examine the evidence, okay? Examine the evidence, slow down. You do not have to make a decision today. Take a week, take 2 weeks, gather the data, and then let the evidence lead you to the conclusion. That's number one, I think. The other thing I'm thinking about as I think through the different aspects of Dr. Fauci is, Dr. Fauci was in a position of influence. We looked up to him. The country looked up to him. The scientists looked up to him. The government looked up to him, right? There is this phrase, right, in Spider-Man that says, with great power comes great responsibility, right? It's very true. And it's actually a theme of the Bible. It's not just in Spider-Man. The more power you've been given, the highest standard you're held at. So one of the things that I think about is like, we have to be careful about who we are putting up on pedestals, because they have influence over our lives. What they say, how they behave, what they do, have unspoken ways of influencing our words and our actions and our thoughts. So be careful about that one. Let me flip that coin. We have influence over other people. A lot of times we don't even know. Like, I was surprised when one of my nephews were telling me that earlier this year, saying that they looked up to me and they followed me and my actions. They mentioned about actions that I did not know that they even noticed. And what it tells me is like, there people are watching you. You have more influence than probably you think you do. So be careful. Be careful about how you behave, how you act, how you talk. Your thoughts, your words, they're important. And this is all biblically sound, by the way, right? It talks about being careful about your words. The Bible, that Jesus says, for every careless word you speak, you will have to give an account to your Father who is in heaven, right? So these are important things. So that's the other thing that I learned from this. So, and not related to your question, but one of the things that I know it's easy to say, we did this wrong, we did that wrong. Why couldn't we be like Sweden? By the way, Sweden is only like 10 or 11 million people. We are 340, 350 million people. And we are a different culture, right? We are a different culture. We are different people. But also remember, we are also the ones who brought the vaccine. Nobody, like in the history of vaccines, thought it was possible to get the vaccine ready by, what was it, November? It was ready? That is just crazy. So one of the things that you learn is when we put our heads together, when we have a singular mind to accomplish something, right? We can accomplish it. We are a special country. And when we put our minds together and the resources together, we can get to a goal that is unprecedented.
Yeah, I agree. And I think it's so important, as you mentioned. As Christians, don't jump before examining evidence. Slow down. Think about things, especially as we do this post-mortem on what happened during this period. The latest thing that people are jumping on him about is stating that he intentionally withstood data showing that the vaccines caused miscarriages. And so there's this meme going around with 82% rate where, they're saying that 15 to 20% miscarriage rate was a result of the COVID vaccine. That's incorrect. If you really dig deep into this, right, there were many trials, many analyses done after the vaccine was given to many pregnant women. There's a baseline of miscarriage apart from the vaccine, which is 10 to 12%. And with the vaccine, the baseline stayed the same. And so there was not a heightened risk if you look at the data. Now, if you listen to this a year later and something comes out that disproves my point, that's fine. But the point I'm trying to make is this, right? You shouldn't jump on someone from a meme you read, even a headline on the news, and say that person is a liar and they deserve to be thrown in jail. Secondly, I think we need to pray for our leaders. The Bible tells us we should pray for those in charge. We should pray for Fauci, pray for our president, pray for your senators. The next catastrophe or emergency is only around the corner. And so we always need to be praying before something happens as opposed to waiting for a crisis to occur. Thirdly, I think we need to trust God, right? Before COVID, during COVID, and after COVID, God is still on his throne. The Bible says that God counts every hair on your head. And so you went through COVID and maybe you lost someone, you lost a family member, you had difficult mental health struggles. Even through those things, God was in control. He was sovereign over those things. And so we need to ask ourselves, when bad things do happen, why does God allow it to happen? And how can I trust him through that, knowing that this was fully within his control? Fourthly, I think we need to exercise grace. Right? Again, you look at a headline on Fox or CNN and you want to look at Fauci and say the guy is a liar who wanted to kill people. I think you need to have a graceful response based on facts. Again, listen to our podcast. Remind yourself of what you went through during that time, the anxiety and the panic you felt. I think we saw a man trying to do the best thing, trying to portray confidence, a man trying to give advice that was clear in an environment that was dynamic, that was static, that was not static, where things were changing all the time. And so grace is essential. Just as Jesus gives us grace, we ought to give grace to other people. And so a lot to learn from this pandemic. I don't think we fully learned as a nation, right, what we should have done. There is much more room for improvement, as you talked about. And so let us know what you think. Drop us a comment in the thought and let us know how you feel. Should Fauci have pled the fifth? Does he deserve to be thrown in jail? And what else as a nation should we be doing? Again, thank you so much for joining another episode of The Balanced Lens. We hope to see you guys next week.